You're listening to RazorCast, USA's hottest podcast, bringing you cutting-edge interviews from leading industry professionals.
Hello, everyone. This is Liz Harvey coming to you from our studios in New York City, where we are dedicated to bringing you top-quality advice from many of the leading expert professionals across the U.S. In today's episode, we are speaking with chiropractor Dr. Larry Arbeitman. Dr. Arbeitman earned a Bachelor of Science degree in Kinesiological Science from the University of Maryland at College Park and graduated magna cum laude from Logan College of Chiropractic in St. Louis, Missouri. Dr. Arbeitman is the founder of Upper Cervical Chiropractic of Monmouth, located in Marlborough, New Jersey, and has overseen more than 150,000 patient visits in nearly 12 years. He has become well respected within the profession, and most specifically, the upper cervical specialty. He routinely trains, teaches, and lectures nationwide to colleagues, students, and the general public. He is currently an active board member for the QSM3 Upper Cervical Method. Today, he will highlight several of his key points from his book, The Gift of Hope, The Path to Healing Through Upper Cervical Care. Dr. Arbeitman is widely considered to be one of the top chiropractors in the country, and he's also a contributing member of our national network of industry professionals. Today, we are going to talk about a very important topic: osteoarthritis, disc problems, pinched nerves, and stenosis. Oh my! Hello, Dr. Arbeitman. How are you today?
Hello, Liz. Great to be with you.
Well, thanks for joining me. So, what is osteoarthritis?
Well, I guess this is going to be a little bit of a technical conversation, but that's okay because people want to know. You know, osteoarthritis, you can think of it very simply as the wear and tear arthritis. It's not the inflammatory arthritis like rheumatoid arthritis. It's the wearing down type of arthritis. And, you know, similar to a car's front end going out of balance and then all of a sudden you look down and one of your tires is balding but not the other. It's a wear and tear that's happened over the years due to imbalance of forces and stress on whichever joints of the body. It could be the knees, the hips, the back, the shoulder. There's three phases of osteoarthritis too. So it develops. So in the first phase, you may just see some thinning of cartilage or a disc if you were looking at an X-ray. In the second phase, you'll start to see some bony changes happening where the body is laying down bone around the joint. And by the third phase, the disc or the cartilage is really worn down and the body has laid down a lot of bone. And this area, because of the loss of motion, can become inflamed, stiff. Patients can feel very achy in the morning. Usually the morning stiffness is one of the cardinal signs that someone has osteoarthritis.
And can you give us some examples of common disc problems people have?
Yeah, I think there's some similar words that get thrown around, and it can get kind of confusing for a patient. Basically, the disc is the cartilage shock absorber between two vertebrae or two bones in your back. The disc has two functions. It absorbs shock when we're living, walking, and moving, but it also creates space for the delicate nerves that come out in between. If that disc starts to break down and wear down, secondary to trauma or compression over time, the inside of the disc, if you picture a jelly donut, it's very jelly-like, can start to push out. So imagine I sat on one side of a jelly donut and the jelly started to bulge out the other side. That's a bulge. We call that a disc bulge. If the jelly came out of the donut, we would call that a herniation or disc herniation. And if the jelly actually separated from the donut that it came from and was just kind of floating around, we call that an extrusion or sequestration. And so these can get kind of confused, but for the general public, they usually call it a slip disc.
Okay. And how do you explain what spinal stenosis is and how it affects people?
Yeah, so spinal stenosis is sort of one of the end stages of this lifelong process of osteoarthritis. See, what a lot of people don't realize is arthritis is a condition that starts in the literature in the late teens or early 20s, and it just accelerates and picks up over time if the cause isn't corrected. So if it starts out with the cartilage thinning and then the body laying down bone, 20, 30, 40 years later, if enough bone is laid down, that bone starts to grow within the spaces where the nerves exit the spine, or even worse, the space where the spinal cord runs down through the spine. And so stenosis is a fancy doctor word for a closing of an opening. Anything that closes an opening that a nerve runs through is stenosis, and it can be quite debilitating because if there's less room for nerves, ow, it can send pain down a leg, down an arm. It can create neuropathy, pins and needles, numbness, burning. We need to get to people before they get that far down the road. But the beautiful thing about chiropractic and gentle upper cervical chiropractic is that even people with end-stage stenosis, where it's been there for years and decades, can still benefit, and pressure can be taken off of the nerves that are being crowded by the stenosis.
And do these conditions share some of the same underlying causes?
Absolutely. See, what oftentimes happens when a patient has, let's say, a neck pain or back pain, and they go to a doctor, the doctor just takes an x-ray or an MRI of that part or that level. They point to the image and they go, you've got stenosis or arthritis at your C5. It's part of the normal aging process. And my question would be, well, how old are the bones above it and below it that don't have it? It has nothing to do with aging. The same way someone may need a right knee replacement but not a left knee replacement. The right knee is not older than the left knee. So there is a cause, and it's a mechanical cause, and we need to look at the body as a unit. The neck and the back aren't two different body parts. They're an organ called the spine, and our spine is subjected to trauma and stress over the course of our life. There's two types of trauma: macro trauma, like a car accident or falling off a horse, or micro trauma, which is what most people are subjected to, like sitting in a cubicle for 8 hours a day for 20 years, or on a bus commuting or looking down at our technology. But once we take trauma to the spine, and if I push your body from the left, it's going to go to the right. If I push you from the right, it's going to go to the left. But the one direction it can't go is into the ground. So once the spine gets traumatized, it will compensate, and it will turn, it will twist. And once there's a twist put into the spine, it starts to compress. Liz, picture a Pepsi can. You can take a can of soda and push it down, and it won't collapse. It's strong. It's got structure. But once you twist just a little bit, the whole can collapses. That's the same thing with the spine. Once there's a trauma and it starts to twist, it starts to compress, there's no pain. It leads to abnormal movement patterns, wear and tear. Eventually things start to wear down. Then the pain comes. Then the patient goes to get their MRI or their x-ray, and the doctor says, there's your problem. You have arthritis or stenosis or a disc herniation. But there was a whole process that happened before that. We're the only spine specialist that goes back to the initial trauma that started the whole mess to get that corrected. Because even if you fix that one level where the arthritis is, but you don't correct the trauma to the spine, when we see this with patients who have spinal surgery, the level above it or below it ends up getting a problem.
Mm-hmm. All right. Now, in what ways does upper cervical chiropractic care help with these conditions?
What's beautiful about upper cervical care is we can look at the body as a unit. We can posturally analyze where the trauma and compensation is that's causing the arthritis to begin with. And through a gentle corrective procedure, we can rebalance the pelvis, the spine, the neck, and the head to create what we call tensegrity, a position where the body is in better balance, gravity is hitting it more evenly, and it's not going to be leading to these abnormal movement patterns and wear and tear. And one of the nice things about this, although you can't reverse arthritis, so it's not like if you have tooth decay, you can get your tooth back, and if you have spinal decay, you can't get it back. But by correcting the cause and getting the proper mechanics, and we really are the mechanics of the spine. I mean, we're really one of the only professions that look at the position of the spine from where it is to where it should be and have a method without using drugs or surgery to get the spine in a more optimal position. And so we do this all through a gentle adjustment through the upper neck, using mechanics and leverage to put the body into a more sound position.
And lastly, can osteoarthritis be prevented, and can it be maintained so that it does not get worse?
You know, I'm definitely a measurement guy. We measure everything in our office, from posture to x-rays, and then you have to remeasure. You have to have objectivity in healthcare. So we'll re-x-ray our patients at different intervals. And there's two patients that come to mind that I just re-x-rayed, and they're both in their 80s. And Alice started care with me when she was 70 years old, and we just took her x-rays at 80, and there has been absolutely zero progression in her osteoarthritis in 10 years that she's been utilizing upper cervical care on a maintenance basis. And I've always told patients there's two goals to your care. Of course, we want to help you feel as good as possible, as quickly as possible, and end your suffering now. But more importantly, if God willing I was your chiropractor 10 years from now and we took another x-ray of your spine, we'd want it to look the same, meaning your osteoarthritis is not progressing. And when I showed that to Alice, and we actually saw improvement in the curvature in her spine and no progression of her osteoarthritis, she said to me, "Dr. Arbeitman, I feel better at 80 than I did at 70." And I think if we can replicate, and Alice is about to go to Israel and do some hiking at 81 years old, and so, you know, we have unbelievably active seniors in our practice. But imagine if Alice had known about our care when she was 30 or 40, how much less suffering she would have had to have gone through over the course of her life.
Well, thank you so much, Dr. Arbeitman. We know you're extremely busy, so I just want to thank you for your time and your help today.
The pleasure is always mine.
And for our listeners across the country, if you are interested in speaking with the doctor, please visit www.getwellnj.com or call 732-617-9355 to schedule an appointment. Consultations with Dr. Arbeitman are always complimentary. He has never charged anyone to sit down and have a consultation in order to discuss their health needs and whether or not upper cervical care may be right for them. On behalf of our team, we want to thank you for listening, and we look forward to bringing you more top-quality content from our country's leading experts.
You've been listening to RazorCast, USA's hottest podcast, bringing you cutting-edge interviews from leading industry professionals.